Welcome back. Efforts to help those addicted to drugs and prevent more overdoses appear to be working in Clark County. Deadly overdoses dropped by a third from 90 in 2016 to about 60 in 2017. According to health officials, the county's needle exchange program and the use of Narcan have contributed to that decrease. Now, although numbers are promising, the community still has a long way to go, and they're getting help from someone you might not expect.
Incarcerated and sometimes infected.
To me, it became a no-brainer.
Sheriff Jamie Knoll supports the county's needle exchange program, but he admits it took time.
I wish we lived in a community, in a world that no one used drugs, but let's face it, that's not a reality right now.
At first, like many people, he opposed the program. He first thought, why enable an addict's IV drug use? But he says after seeing inmates struggle while in custody at the Clark County Jail, he had a change of heart.
So I don't condone them using drugs. If they are going to do it, at least hopefully we can help reduce, IV, transmitted diseases like HIV, hepatitis.
Since starting the needle exchange program last January, public health nurses in Clark County have handed out more than 32,000 needles. Drug users have returned close to 20,000.
When somebody is in the place where they're ready to get help, they trust our public health nurses to get pointed in the right direction.
In addition to guiding participants toward treatment, nurses also treat viruses often spread by IV drug use, such as Hep C. Clark County had 321 confirmed cases of Hep C in 2017. That's up from 270 in 2016. Dr. Eric Yazel says the increase means more people are getting tested.
I know while those numbers may be a little difficult to interpret, we actually view that as a win as well.
And there's another important number health officials view as a win, 30%. That's the drop in overdose deaths in Clark County from 2016 to 2017. Indiana's drug czar, who toured Clark County earlier this year, says it's clear the needle exchange program is working.
I'm just so grateful for good news on this front.
Dr. Yazel says the effort doesn't stop here. The needle exchange program just extended its hours from 1 day a week to 4. The hope is to encourage more drug users to participate.
A lot of times our hours aren't the most convenient to them and things, so we need to get out in the county and try to reach out more and make sure that anybody who is interested in using the syringe program has the availability to do so.
Sheriff Knoll believes the program is only part of the solution.
We've now since added our second detective that is targeting, drug enforcement and dealers.
His goal is to target drug dealers who he says are ruining countless lives.
We're trying to target the actual dealers that don't use drugs at all. The most successful drug dealers don't use drugs. They profit off of the addicts and off of other people's misery.
For State of Addiction, I'm Morgan Lentis.
Locked up, addicted to drugs, and pregnant. It's a growing problem, and now Metro Corrections has a plan to help both mother and baby not only survive addiction, but also withdraw. We go inside the jail's Enough is Enough dorm with a look at their methadone treatment program.
I had a couple of years of sobriety, and when I stopped working the steps and utilizing the tools, I relapsed.
And she ended up here, Louisville Metro Corrections. It's not her first time in, but now she's in the Enough is Enough dorm. It's a residential treatment program.
We get into our step work here. We dissect the information. We study the book, also criminal thinking. I lead the criminal thinking classes here also.
Yeah, and manageable.
Many women like Stacey McCubbins are jailed on drug-related crimes, and in some cases, those women are pregnant.
We're projecting this year to detox about 10,000 people.
That's why Director Mark Bolton and his staff partnered with the Moore Center and Public Health to start a methadone program for pregnant and addicted inmates.
When we had 11 pregnant women in here, 9 of them were opioid addicts. And that was before we started the program, and that was a very clear indication we've got to do something different and something better, protect that unborn fetus.
The mothers are given the option of joining the program, receiving methadone, which prevents withdrawal, and participating in counseling and group therapy. Bolton says they have now successfully treated 3 pregnant women.
It really is not a matter of being off medication. It really is a matter of return to functionality. So the first step in that process really is drug-free.
Dr. Mark Jurish is the medical director for the Moore Center. Methadone patients are under his care. He says the treatment doesn't stop when the women are released from jail.
If you look at the biologic changes, most people actually do need continued medication. At least they need long-term medication treatment. So this isn't something you get on and you're off in 30, 60, 90 days. Typically, people can be in treatment for years on medication.
The methadone program is less than 2 months old, but Regina Davis, who oversees the jail's nurses, says they are already seeing success.
We've also heard some good success stories about women who have been able to go out and be mothers again, and they're raising their children.
I'm Stacey. Enough is Enough has taught me that it doesn't matter how many times I relapse or how many times I screw up, I can be successful. If I utilize the tools that are in this program that I've been handed, I can be successful.
For State of Addiction, I'm Jennifer Bayless.
You can find resources for treating addiction on our website, WLKY.com, and our mobile app. WLKY is dedicated to bringing attention to the state of addiction in our communities. We hope you take the information presented today, discuss it, and pass it on. For WLKY, I'm Stefan Dingle. Thanks for watching.